October is called Pink Month to commemorate the importance of breast cancer world over. We know that in the world, maximum number of women die today with a breast cancer than even heart attack. So that is the significance of breast cancer to the common population world over. So what does Pink Month signify? Pink Month signify to the women of the world that breast cancer is a common cancer, but it is preventable. It can be detected early. If detected early, we can avoid mastectomy or removal of the breast. We can preserve the beauty and we can cure the persons. Which means in breast cancer, unlike other cancers, early detection is a possibility. We have got so many novel investigations also, which will help in treating also the patients effectively, targeted approach, as well as with a comprehensive gene profiling and a different methodology called immunotherapy. So all these novel modalities are available for us, but still in the world, most of the patients, more than 60% in many parts of the world, present in advanced stage. Why do they come in advanced stage? Because if you personally ask the women who come in either locally advanced or advanced stage, they always will tell that they are afraid of the fact if people know or when even they report to the doctors, they will tell of removal of breast or mastectomy, which will disfigure them and will create a lot of psychological trauma. And how can we bypass that? We can bypass this so-called mutilating surgery by means of early detection, awareness and prevention. In breast cancer, current WHO slogan is that women are not alone in the treatment or even the fight against breast cancer. To spread this good message, we celebrate Pink Month world over. Now let us come to the realities. How can we prevent breast cancer? We know that in carcinogenesis or development of cancer, there are so many factors involved. And today we also know that those are the women in whom maximum cancer breast is reported are those with obesity. Obesity is a number one killer because once you are obese, a lot of hormone deposition will take place in the fatty tissue, and that will itself act as a hormone secreting organ. So therefore we need awareness. We need to understand how to prevent this problem. And today it is also important, unlike in the past, we get more young age women with breast cancer, less than 30. Even before they start their career or their life or their family life, they may fall prey to breast cancer. So obesity is one factor, an early menarche and late menopause. Similarly, when in molecular family, hardly there is one child. Even breastfeeding is not so common today. And also there are genetic factors which are predisposed to cancer. If there is only one tool, if we ask how to completely prevent breast cancer, these are the group of people where they are genetically predisposed, like BRCA1, BRCA2, genetic abnormality. The best example in the world is Angelina Jolie, who is a Hollywood film actress, who has undergone bilateral mastectomy or removal of breast because she is a BRCA1, BRCA2 positive candidate, genetically determined breast cancer. But there is something else also we should understand. There are so many warning signals in breast cancer, like a lump in the breast. After maybe 30s, one has to rule out cancer because even if 80% of the breast swellings are non-cancerous, still we should understand as age advances, cancer of the breast becomes a common event. Number 2 will be indrawing of the nipple. If there is a change in the nipple and if indrawing, that may be a warning sign for breast cancer. There can be in some women small ulcers happening in the nipple. It's called Page's disease of the nipple. That also is a sign of breast cancer. There can be women who come with discharge from the nipple, either colorless or with blood. That could be also one of the symptoms of breast cancer. Some women come with thickening of the breast. No palpable lump, but a thickening of the breast. That is also a sign of breast cancer. And in advanced stage or locally advanced stage, many of the women come with ulcers on the breast because of the underlying tumor, or this breast tumor spreads to other parts of the body and they come and present with dyspnea or difficulty in breathing, or because it has spread to the lungs, or they come with jaundice because the tumor has gone to the liver, or they come with convulsions because tumor has gone into the brain. And similar advanced situation, bone fracture. These are all signs of advanced stage. But we want our women to report, if by misfortune they have got a breast cancer, they should report early. So therefore, what is the message for women all over the world? That breast cancer is a disease which can be picked up very early. We have to know what is breast self-examination. Breast self-examination is one of the simplest, easiest and no-cost technique to detect breast cancer. That is, before the menopause, means in the fertile age group, if women start doing breast self-examination in the mid-cycle, not before periods or immediately after the periods, and if any suspicious lumpy feel or painless swelling is picked up, they should immediately go and report to a doctor who will do further tests. Or if people who are susceptible, or if the tumor runs in families, breast cancer, they should definitely undergo a first mammography by the age of 40. If no mammography is available, they should undergo ultrasound scanning. So therefore, there are methods to pick up the disease much early. What is the value of picking up the disease early? The value is women need not undergo a mastectomy or removal of breast and disfigurement. They can undergo very limited method of treatment. Some women, even we can avoid chemotherapy and radiation, provided it is picked up very early. So therefore, modern era, there are so many methods by which we can fight against breast cancer. And also, unfortunately, many women present with an active disease. If there is an active disease, we will categorize them into which stage they are. Definitely, those diseases which are picked up by mammography, ultrasound or self-examination are really preclinical situations, which means cure is 100%. Barring very few cases where there is HER2 positivity or they are genetically predisposed women. So then they need adjuvant treatment even if they are picked up in the early stage. Whereas those present in the stage 1 disease, they are very lucky people, because in majority of the situations, we need not do mastectomy. We can do what is known as breast conservation treatment, or there is modern technology available known as breast oncoplastic surgery. Onco means cancer, plasty means to mold, which means they can regain their physical attraction even after treatment. And that is a big boon for women to go for early detection of breast cancer. In those patients who present in little more advanced stage, we call it stage 2 disease, there are situations whereby we can reduce the tumor size by giving them neoadjuvant chemotherapeutic regimens. By virtue of that, what we mean is tumor can be shrunken. That is a new concept. In the past, this modality of treatment was offered to locally advanced breast cancer, which means tumor has grown in the breast and in the axilla, maybe lymph nodes, but by virtue of its biology or its aggressiveness, it has not gone to other parts of the body. Usually, breast cancer can go to liver, to lung, to brain, to bones. And even to ovaries. So if it has not gone to any other parts, we call them locally advanced. In locally advanced tumors also, tumor size may be more than 5 centimeters. In some cases, tumor may be small, but it is already eroded onto the chest wall, or if the tumor has grown out to involve the skin, producing skin ulcers or satellite nodules, or it may be involving the nipple areola complex by pulling the nipple inwards, or it may present with bloody discharge from the nipple. Such situations, we do what is known as metastatic workup, which to the common man means that has the tumor gone outside the limits of breast to all these areas which I mentioned. For that, we do a core biopsy to diagnose what is the pathology behind this tumor. Definitely that is important for us. Along with that, we do what is known as metastatic workup by doing a PET scan. A PET scan, otherwise known as positron emission tomography, it picks up the areas where the disease has gone, if it has gone. If not, we categorize them as locally advanced breast cancer. If they are locally advanced breast cancer, based upon their pathology, we will definitely give them treatment, and those treatments will be targeted treatment. We all find out which factor in the tumor is highly malignant. Then accordingly we tailor the treatment to suit the requirement to give a cure to the patient. So that is possible today. And by misfortune, if any patient comes in advanced stage, still the modern medicine is offering them a chance to get better survival. How can we do that? We know there are two types of metastatic disease, or the disease which has spread to other areas. These are called life-threatening diseases or non-life-threatening diseases. Life-threatening diseases are the ones which need urgent interference. Like if there's a tumor which has gone to the brain, patient may need an urgent radiation. Or if the patient has got a tumor which has gone to the lungs, producing breathlessness, that is because of the pleural effusion, then we have to treat them urgently. Similarly, if the tumor has gone to the liver and produced jaundice, we need urgent treatment. Whereas, if the tumor has gone to the bones alone and nowhere else, depending upon where the bone, in the bone it has gone, like if it has gone to the vertebra, or it has gone to the hips, or it has gone to the other areas of the bone, we should be able to treat them in a better way. So these are good prognostication type of metastasis. But because of the latest development in comprehensive gene evaluation, what we are now blessed with findings, possibilities to use body's own defense mechanism against the cancer. That is known as immunotherapy. So therefore the spectrum is so wide for us to treat breast cancer. The only thing is we should know that here is one disease which can affect any women. According to WHO, 1 out of 6 women has got the possibility of developing breast cancer. So we need to be vigilant. Why should we be vigilant? Because we pick up the disease early. Number 1, breasts are not to be removed. Number 2, very aggressive chemotherapies need not be given. Number 4, some people may not require a radiation. Number 5, majority can be cured. So if the message is a cure from breast cancer, Pink Month is giving us a great opportunity to spread the message to other people, as well as the women should be urged to undergo examinations to pick up the cancer early, and an urge to change the lifestyle. By the age of 40, we should change our lifestyle to less fatty situations in the human body by adjusting the diet, because diet is the number one agent which leads to obesity or hormonal imbalances. So therefore, Pink Month is offering us a better opportunity, a possibility of cure, and of course, breast cancer is a villain for the families, because women are the fulcrum of the families. Moment one is affected with cancer, especially a cancer like breast cancer, the balance in the family also changes. Because all those women who undergo mastectomies, we know that when they are physically challenged or physical abnormality or ablative surgery happen, even certain situations, family relationship even may spoil. So therefore we should think positively, we should act positively, and remember that a curable disease is today breast cancer. We should use all the opportunities to pick up the disease early and have a normal lifestyle. As a last sentence, I should tell that breast cancer is not only happening in women. Men also can develop breast cancer. Therefore, any swelling or a tumor occurring in the nipple in men, especially after middle age, should always be investigated, because I have seen so many men coming with male breast cancer. So let us have a pink month which should bring in positive vibes in families, in society, and the nation as a whole. Thank you.